So right now at the White House, President Donald Trump announced a slim down in the prices you pay for weight loss drugs. So how does the president say he'll do it? Through partnerships with drug company Eli Lilly and Novo Nordisk. Now, for the most eligible, and think about this, the cost could be just under $250 a month. Compare and contrast that to this. Right now, people who use those same drugs pay around $1,500 a month, give or take a couple $100 on either side of that number. Health and Human Services Secretary Robert F. Kennedy Jr. was at that announcement. He says this deal is going to have the biggest impact on you at home, the American people. Listen.
It is the #1 cost of all drugs. This is the biggest drug in our country. That's why this is the most important of all the MFN announcements we've made. This is going to have the biggest impact on the American people. All Americans, even those who are not on Medicaid and Medicare, are going to be able to get the same price for their drugs, for their GLP drugs.
All right, so let's bring in family medicine physician and founder of Beyond Clinical Walls, Dr. Bayo Curry-Winchell. Doctor, nice to have you with us today. What do you make of this announcement?
This announcement is really instrumental for people to be able to access a drug that is over 12% of Americans right now are accessing GLP drugs. So to have this medication to be able to lose weight, it's phenomenal.
Well, we know that ahead of those Oval Office remarks, we learned that Eli Lilly, major drug maker there, made the decision to move its obesity drugs to what's called late-stage trials. After it showed some promise, you watch the trials as they come in and get published in medical journals. They say it's helped patients lose as much as, 20.1% of their weight in mid-age studies. Walk us through what kind of processed drugs like this go through before they hit the shelves.
So there's a lot of things that have to happen before a patient actually has access to a GLP. We want to make sure that it's going to be safe. We also want to be mindful of what side effects could happen, so therefore we can respond to it. So it can take years for a medication like this with a GLP-1 to actually come to market and for people to actually use it.
So how many people currently use these in the United States? Because I'm also very aware of the drumbeat of people who are now signing up for Obamacare or open enrollment, that the price of their health insurance has just gone through the roof. Jaw-dropping for many families who are already suffering economically. And these drugs, in part, are to blame for those sky-high prices. How many people are we talking here? Because that helps us to sort of do the math in a backwards sense.
Yes. Well, a study showed from 2018, over 8 million prescriptions have been used for GLP-1s. So that averages out to about over 12% Americans have already been using GLP-1s.
Okay. Well, that's a lot of Americans there.
Yes.
Thank you so much, Doctor. We wish you a good day.
At the White House today, President Donald Trump announced a deal to make weight loss drugs more affordable. Trump says drug makers Eli Lilly and Novo Nordisk agreed to lower the price of their popular GLP-1 drugs. And the president claims those eligible could see the price drop by more than $1,000 a month.
Eli Lilly and Novo Nordisk are committing to offer Zepbound and Wegovy at most favored nations rates for American patients. This will slash the cost of Wegovy from $1,350 a month to ultimately $250 a month.
Let's bring in CBS News medical contributor Dr. Céline Gounder. Dr. Gounder, thank you so much for being with us. America's appetite for these weight loss drugs is growing and fast. We know obesity is still an epidemic in this country. Do you think making these drugs more affordable is going to have a big impact on the health of millions of Americans?
I think it's important to point out that these medications are not going to be made available to anybody who wants them, who is on Medicare or Medicaid. And being obese in and of itself, or being overweight in and of itself, will not be an indication for having access to these drugs at a reduced rate. They're really focusing the access and the more affordable pricing on people who are at high risk for complications of being obese, people who are at high risk of heart disease, of stroke, of kidney failure, and other such complications. So it's not still going to be as easily accessible and as cheap as many people would want, particularly when you consider that at least 40% of the American population, if not more, depending on what definition you use, is obese.
Yeah, that's a really great point. I want to get to that in a moment, but I want to mention that it's not just weight loss, that there are other benefits from using these drugs, including reduced risk of certain cancers and even improved cognitive function. Right now, a patient, as you mentioned, has to qualify for these drugs. They need to have, as you said, certain health conditions and a high BMI. But given the other health benefits, do you think that these drugs are going to eventually be available to more people?
Well, we don't know yet because these drugs have really been studied in people who have not only obesity, but also other medical conditions. And so that data on preventing cancers, on preventing other medical conditions, is really focused on experience with that patient population. So we really need to have more data on looking at people who are overweight or obese, but do not have those other conditions. Do you still see a protective effect against cancer, against cognitive decline, against sleep apnea, you name it, in terms of the list of other conditions that these medications appear to prevent? Will that work for a broader proportion of the population? We just don't know yet.
There are also a lot of compound versions of these weight loss drugs now in the market. They were largely created because as a less expensive alternative to the name brands. Now that the name brands are more affordable for certain patients, do you think these alternative drugs will simply go away?
Well, the reason those compounded drugs were legal, at least for a period of time, is because there was a shortage of the drugs like Wegovy and Ozempic and Zepbound. Once that shortage ended and was declared over by the FDA, that loophole that allowed these compounding pharmacies to operate closed. And so now they are operating illegally, essentially. And you have companies like Novo and Lilly that are now suing and going after the compounding pharmacies because they are replicating, and it should be clear, not precise replication of their name brand medications. There are some issues with safety and efficacy on top of the fact that they are trying to replicate a branded, patented drug. And so there is a legal issue there as well.
As a doctor, though, are you confident in the efficacy of these drugs? Do you think that they're the future of medicine in many ways?
Well, look, we have an obesity problem, as you said at the top, and that is not going to be solved by these medications alone. People in public health have been saying for decades now, we really need a solution that addresses root causes, not just the problem once we have it. And so I think, yes, these GLP-1 weight loss drugs will be part of the package, the solution, but in and of themselves, they are not the silver bullet, and we will need other solutions as well.
Dr. Céline Gounder, thank you so much.
As we've been reporting, President Trump announced today a deal with Eli Lilly and Novo Nordisk to lower the cost of their weight loss drugs for some Americans. Without insurance, the price of these injectable medications, also known as GLP-1s, can reach up to more than $1,300 a month. But under the president's plan, Wegovy's lowest dose would start at $245 a month. Zepbound's lowest dose would start at $149 a month. For more, let's bring in Dr. Holly Lofton. She's the director at New York University's Langone Medical Weight Management Program. Doctor, thank you for being here. What does increasing access to these weight loss drugs mean for public health and obesity rates in the U.S.?
Thank you for having me. Right now, we're in a situation where patients are either having to self-pay those high numbers that you just quoted for these medications, or they're using their private insurance. However, Medicare and Medicaid patients who utilize those resources don't have access to these medications that have $1,000 price points. So getting these numbers down to the hundreds can really help 35 to 60 million beneficiaries of Medicare and Medicaid have access to these important drugs that not only help with weight management, but also improve other conditions such as heart disease.
I mean, you touched on it. What's the 30,000-foot view of what this looks like for public health? Because we know a lot of people, they try and diet, they try and exercise, and those things just simply aren't enough.
Well, we know that in trials where we look at the efficacy of these medications, there's always a placebo group, and that group is doing diet and exercise. They usually lose about 3% of their weight, which is negligible, and over time, that really doesn't lead to a decrease in mortality or morbidity risk or disease risk. So improving access to these medications can help us further cut downstream Medicare and Medicaid costs for things like cardiac admissions and severe heart conditions admissions such as heart failure, severe diabetes, and other medications uses that we are using right now, we may not need as much of them as we have access to the GLP-1s for our people who have Medicare and Medicaid.
Do you know why those government health programs have been so restrictive in the past when it comes to these drugs?
Well, there is actually a law that stems back from the 90s when there were medications which weren't as safe for weight loss that actually did cause valvulopathy, which is a heart valve disease. So there was a law made for any CMS beneficiaries that they will not cover weight loss drugs. Now, we know that the GLP-1 agonists are more than weight loss drugs. They don't solely suppress appetite. They help fat cells shrink. They really go to the core of the brain and gut pathway to get us to lose weight, but also decrease risk of heart disease, sleep apnea, other conditions such as fatty liver. So we are seeing these medications being safe and effective for long-term use in trials and in the general population.
Dr. Holly Lofton, thank you.
Thank you.
Affordability was a key issue in many state and local elections this past week.
Today, Dr. John LaPook reports the Trump administration and pharmaceutical companies reached an agreement that will lower the cost of weight loss drugs.
We're bringing drug prices down to levels that will be as low as possible.
The high price of the world's most groundbreaking weight loss drugs is about to slim down.
This is a triumph for American patients that will save lives and improve the health of millions and millions of Americans.
Next year, the agreement with pharmaceutical giants Eli Lilly and Novo Nordisk will make popular GLP-1 drugs such as Zepbound and Wegovy more affordable through Medicare and Medicaid and direct to consumer through the Trump RX website. For Medicare patients, monthly out-of-pocket costs will drop from over $1,000 to as little as $50. The White House said all future GLP-1 drug launches by Eli Lilly and Novo Nordisk will be sold at lower prices across Medicaid, Medicare, and commercial insurance, with widely used drugs 60% lower than now.
So, Dr. LaPook, what does this mean for improving Americans' health overall?
Maurice, I think it's a really big deal. Obesity is a crisis that increases the risk of heart attack, stroke, cancer, diabetes, aches and pains, you name it. I have a lot of patients who simply cannot afford a GLP-1. The CEO of Eli Lilly said today that this action could increase the affordability and the availability of these drugs for 30 to 40 million Medicare recipients alone, and the hope is that commercial insurance will follow suit.
So in tackling the obesity issue, either broadly or a single person, how far do these drugs go?
Well, you know, Dr. Mehmet said something today that really resonated with me, and I just checked with him and confirmed my impression. He said that obesity is not the absence of GLP drugs. And what he meant by that was that we have to really look at the root causes. You don't want to take a shortcut. Yes, these are powerful drugs. Look at the root causes. That includes, you know, things like, of course, diet and exercise, but also do a deep dive into things that maybe we haven't thought of, including we have to talk about the improved availability of fresh, affordable food that's free of ultra processing.
Okay, good info, Dr. LaPook. Thanks so much.